You're listening to Happier Healthier, a podcast presented by Conway Medical Center. In each episode, we bring you expert conversations and actionable strategies to help you navigate your health and well-being, fostering a happier, healthier life for yourself and your loved one. This podcast is made possible by the CMC Foundation. Their impact in our community is truly transformative. Think about this. Since 2005, the CMC Foundation has funded over $700,000 in mammograms for underserved individuals. They've invested over $200,000 in scholarships for CMC employees continuing education over the last decade, directly strengthening our healthcare workforce. And through the CMC Smart Snacks program, they've supplied over $559,000 in provisions to Horry County children. The foundation also provides crucial support like over $8,000 for cancer patient transportation. These are just a few examples of how they actively enhance the health and quality of life for individuals in our community. If you're tired of chronic back pain controlling your life, this episode is for you. You are not alone. There are so many people in our community who struggle with this everyday challenge, often wondering about the best path to relief. On today's Happier Healthier episode, we are talking with Dr. Mbuvah from CMC Pain Management, and he will walk us through effective, non-opioid, non-surgical approaches to managing chronic back pain, offering hope and practical solutions. So, Dr. Mbuvah, welcome to the show. Back pain, I feel like so many people have back pain. Every year I get older, my back hurts a little bit more. But
Yes, that's
it's
sort of like
normal.
that's sort of like the normal trend is we all get older, we're all gonna get some type of back pain, So in fact, if you look at the literature, at least 80-90% of adults, by the time they're 60, they've had, at least some form of back pain. So it's common as we get older because of the degenerative processes that, that we all go through. We're gonna have a lot more back pain as we get older.
At what point is that pain chronic? And what are some red flags that are saying, hey, you need to seek care from a pain management specialist like you?
Sure. So chronic back pain by definition is pain that lasts like more than 3 months. So, like I said, we all have a little back pain, but usually it resolves by 4 weeks, But if you start having back pain that's lasting more than like 3 months, and then, that's something to be concerned about. Um, the duration, is one thing that we look at, but there are also other associated symptoms that we really kind of like get worried about, or red flags, if you want to call them, where you really need to seek urgent care. So things like back pain that's associated with weakness in your legs, back pain that's associated with numbness that's going down your leg and it's getting worse, back pain that's associated with a fever, back pain that's associated with numbness around your perineum, back pain that's associated with difficulties peeing or pooping, you know, um, back pain that happens in the setting of someone who has cancer, and then all of a sudden they start having back pain. That's definitely concerning. Back pain in someone with osteoporosis who was sort of okay and then had a minor fall, and then now they have severe back pain. Um, those are sort of like the big ones that we worry about.
So when someone has those red flags and they come to CMC Pain Management, what is the diagnostic process like? Like you say, okay, this is a
Mhm.
red flag, so then what does that mean?
Sure. So most of the people that I see with chronic back pain, would have gone through a primary care, have mentioned that their back pain that's more than 3 months is getting worse. The primary care at this point would have probably ordered an X-ray, just to screen for some of the big life-threatening kind of conditions that we worry about, like infections, fractures, cancers, bleeds. Um, and they would have probably recommended a home exercise program of some sort. Go see your chiropractor, try some physical activities at home. And if that stuff, hasn't worked, that's when they get referred to us. So by the time they get to us, they already have some kind of preliminary, work done, and we take it from there. So the things that I do is I do a detailed history and an exam, and then come up with like a possible diagnosis. And then I do further tests. Most of it will definitely include an MRI. An MRI would tell us more information about your back, your bones, your discs, your nerves, and stuff like that. And then once we get the MRI, and your X-ray and our physical exam and our history, we come up with a plan or a diagnosis, and then we take it from there.
Okay, I know you really emphasize non-opioid treatments, and I know we've
Hmm.
talked about this before, but
Hmm.
for
Hmm.
people that are new or might not have listened to your first episode, what
Sure.
kind of is behind your drive to seek out other treatments rather than opioids?
Opioids, yes. So we don't have a whole lot of studies that have shown us that opioids in the long run help with chronic back pain or chronic pain that's not cancer, so most of the issues that we've had with opioids is that people have used them for indications that are not indicated for opioids, like acute back pain. Unfortunately, opioids are very addictive, so people end up being addicted to opioids, and so we don't want to lead people down that path. Addiction comes with all kinds of problems, not just physical but psychosocial problems. So we don't have data for opioids. Opioids are indicated for usually acute pain that's so severe, and the goal is to take them, if you failed everything else, and then wean them off. But you know, the main concern is addiction, overdose, dependence, and death. That's why we try and shy away from opioids and try everything else that's not an opioid.
How do you have the conversation with patients who come
Mhm.
and say, well, I had a doctor years ago who said opioids are the only thing that'll help me, or
Mhm.
that have that expectation that that's the only solution?
Sure. I usually don't judge them, because they've gone to a doctor and that's what they've been told. But, we know that's really not true. So we try and kind of shed some light on some of the other options that we have. There's a whole spectrum of injections, procedures, minimal invasive minor surgeries that we offer for back pain. And so we discuss this and we present it to the patient. If the patient is amenable to kind of like trying those options, we work on kind of coming down on their opioids or coming off, while replacing whatever opioid that we're taking with some interventions and therapies that we can offer them.
What are some of the injections and other non-invasive options that you do?
Sure. So there's a whole spectrum of injections depending on what the cause of the problem is. If you have a muscle issue, which we call myofascial pain, there's some simple injections called trigger points that we can do in the office. If you have a more complicated problem than just muscle, myofascial pain, if suppose you have arthritis in your back, from small little joints called the facet joints, we can do nerve blocks for those. And then just as a test to see if we ever, target like a certain facet joint and you feel good, we ultimately offer you like an ablation, where we kind of burn the nerves that are going to those facet joints. That usually gives you 6 months to a year of relief. We can also do epidural steroid injections if you have a bulging disc, a pinched nerve, and it's causing pain that's shooting down your legs. Those are some of the bread and butter stuff that we do.
What would you say to a patient who's kind of dealing with it for so long and they're in so much pain and they
Mhm.
just feel like there's no option for them. It's never going to get better.
Sure. So the key is just reassuring them that there's always options, and there's always safer options other than an opioid. So it's a lot of just getting to establish a relationship with the patient so they trust you, and then when you get to that point where they actually really trust in what you offer, and then, we move them in that direction that I'm talking about, where, a lot of the people end up actually um, coming down on their opioids and finding out that, oh well, I didn't know there was stuff like this that we do, and they usually kind of do well when we establish care with them.
So what's the process like if somebody comes in and they get maybe like a nerve block, like you said, or
Hmm.
radio frequency ablation? That's what it's called, right?
Yes, radio frequency ablation, yes.
And so do they come in that one time and then they get it and then they're good? Or tell me
Sure.
how that whole process
That whole
will
process
look.
will look like. So after we've evaluated you in the clinic, we set you up with an appointment at our surgical center. We offer these injections with or without sedation. Um, Usually, like when you're building up to an ablation, we start off with two nerve blocks. So you come in, you get the first round of nerve blocks. They're usually temporary, they last less than 24 hours, but they kind of give us an idea of where your pain is coming from. And then if you're happy with how you feel for that 24 hours, you come back within a week or two. We repeat the same nerve block to see if you get the same kind of results. And if you do kind of like the way you feel on both occasions, and then we kind of set you up for the ablation, like usually within a week or two. So that whole process of going from like one nerve block, another nerve block to the ablation might take you about 6 weeks or so. If it's an epidural, it's kind of like a one-time kind of like deal. You come in, we do a single shot. The epidural usually lasts about 3 to 6 months. If your pain comes back, then we come back and we just do it again.
And is this usually coupled with physical therapy or rehab of some sort?
Yes. So by the time we get to the injections, you would have already started physical therapy. Either it's worked for you or it hasn't worked for you and made things worse. We usually recommend that when we're doing these injections, you continue to do some kind of therapy, either like through a supervised program with physical therapy, or just continue to do your own home exercises at home, because just like continuing to do physical stuff has been shown to actually improve the chances of getting better quicker. So the nerve blocks, the epidurals, the SI joint injections, trigger point injections, those are sort of like bread and butter kind of entry level pain management injections that we do. There are also some more advanced kind of like, procedures that we do that are not necessarily like invasive surgeries like what Dr. Reed would do. And they're becoming more and more kind of mainstay in our field, where patients have tried all these bread and butter injections, but they're too scared to go ahead and go and do the most invasive surgery. So they want something in between, if they continue to suffer with pain, and we offer those. Some of those include the Minuteman procedure, where we can do a minimally invasive, little spacer to kind of open up some spinal stenosis. We can do stuff for the SI joint, where we can fuse them using minimally invasive kind of like, devices. We can do spinal cord stimulators. That these don't involve like any kind of invasive lumbar spine surgeries. We can do the intercept procedure, where we can kind of burn some nerves and some bones that are inflamed in your body. So they're all these other kind of advanced pain management procedures that we're doing that are a little more complicated than just your bread and butter injections, but less than.
Okay, so if there's a patient and they're telling their primary care provider, hey, I have chronic back pain, I'm not ready for surgery, but I need help, is that when they would refer them to you?
Exactly. That's the kind of like the perfect candidate for coming seeing a pain management doctor, because we've got all these options, from the bread and butter stuff to the minimally invasive things. That's pretty good.
Okay, awesome.
Yeah.
Thank you, Dr. Mbuvah, for doing this.
No problem. Thank you for working with me.
That's it for this episode of Happier Healthier. We appreciate you tuning in and hope you gained valuable insights for your health journey. Again, thank you to our sponsor, the CMC Foundation, for allowing us to bring you this information from experts for free. Discover more about the CMC Foundation's vital work in our community and how you can contribute to their mission by visiting cmcfoundationsc.com. That's cmcfoundationsc.com, or find the link in our show notes. And just as a reminder, all content discussed on CMC's Happier Healthier podcast are the individual opinions of our hosts and guests and should not be construed as personalized medical advice. By listening to this podcast, you agree not to use this podcast to treat any medical condition for either yourself or others. Consult your own physician for any medical issues you may be having. This disclaimer applies to any guest or contributor to the podcast. Be sure to subscribe so you don't miss our next episode of Happier Healthier, proudly brought to you by Conway Medical Center.